going to be explaining nutrition in pregnancy and the importance of having healthy nutrition. So it has been found that poor prenatal dietary intake can increase the risk to that child as an adult for obesity. So it just shows how important the nutrition is from pregnancy and beyond. So the expected weight gain is going to vary depending on the pre-pregnancy weight. So the expected weight gain for just a normal pre-pregnancy weight, so someone that's at a healthy weight, normal pre-pregnancy, is going to be 25 to 35 pounds that they should gain in the entire pregnancy. An underweight patient, pre-pregnancy underweight, should gain 28 to 40 pounds. So just depending on how underweight that they are, but that'll be for their entire pregnancy. And someone that is overweight, this patient is not going to be gaining as much. So 15 to 25 is going to be for that patient. If they're obese, sometimes in the obese range, they'll say to gain no weight. But so for a normal pregnancy, 25 to 35, underweight, 28 to 40, and overweight, 15 to 25. And then I just want to make you all aware that you could have a smaller patient, like a normal weight person that is still not as healthy as even somebody that's overweight. So size isn't everything, but we just want to not overlook that and pay attention and make sure that everyone is getting good nutrition. So it's important to help the patients understand that the different healthy food options and that good nutrition is going to be essential for them. So let's look at some of the things that we need to assess in our pregnant patients in regards to nutrition. We need to monitor the patients for something called pica. So pica is when a patient is going to be eating non-food substances. So they're craving non-food substance. A big one is going to be like the laundry detergent, like that red clay dirt. So a lot of times these women are clearly deficient in something, iron, whatever it may be. And so they're craving these non-food items. Then the other thing is the culture. So we always need to take into account the culture. So we need to know what kind of, religious practices do they have so that we can take this into account to see if there's different foods that they're trying to avoid. Because whatever it is, their culture, if we can try to incorporate whatever that is. So it's always important to incorporate and get them a part of making a good nutrition plan. For seafood, so some people think that they can't eat seafood at all. They can, as long as it's low in mercury. A lot of seafood can be high in mercury, and so those should be avoided. Some meals, like shrimp, trout, and catfish, those ones are going to be lower in the mercury. So those are okay and safe to eat a couple times a week. Tuna is one that's less consistent with mercury, so it should be limited just because of the inconsistency. And then anything raw, so with sushi and having raw fish is going to be a no. So we don't want to have any raw fish. It should never be eaten. For our meats, so with meats, completely safe to eat as long as they're well cooked. We don't want them to have undercooked meats. So they need to make sure they're cooking them pretty well done. If they eat deli meat, we worry about a bacteria called listeria. So for the deli meat, as long as they want to heat it, then it's okay because it'll help kill off that bacteria. So for deli meat, we want it to be heated and warmed so that it will kill off the listeria. And then that is fine to eat. So a few other things to look at. Caffeine. So everybody wants their caffeine. We need to limit this to 200 milligrams a day. So it's about 1 to 1.5 cups of coffee would equal that. So you just need to take into account if they're having that. Plus they want some soda. Also, the chocolates also are going to have caffeine in it. So just to take that all into account. So 200 milligrams a day is our limit. alcohol. So never any safe amount to be found. And you can refer to the fetal alcohol syndrome lesson to learn more about that, but there's no safe amount in pregnancy to be recommended. So this should be avoided altogether. And we want to make sure that the patients are aware of that. Fruits and veggies. So these should be washed. We want to make sure that they're getting clean, and we should make sure that they're taking in plenty of that. So we want to assess the amount that they're taking in and make sure that they're getting enough. Water, we should have 8 to 10 glasses a day. So make sure that they're drinking plenty of water, not filling up on sodas and things like that, but actually getting good water content. The cheeses. So cheese is okay if it's pasteurized. If it is not pasteurized, unpasteurized, it's going to be unsafe for them to eat. So usually soft cheeses are going to be the unpasteurized. So those would be the unsafe ones to have. So soft cheeses are things like goat cheese, feta cheese are going to be soft cheeses. So those should be avoided. For iron, so iron is something a lot of women need added to their diet because they become anemic. It's a deficiency. We have a lot of anemia in pregnancy. So if they take iron supplements or eat foods that are high in iron, so examples of that are going to be things like spinach and legumes. Those things are going to be high in iron. Calcium. So good amounts are needed in pregnancy, and it's actually not just for mom, but it's going to help with the fetal bone development and their teeth development for later in life. So calcium needs to be taken in good amounts during the pregnancy as well. And then our last item here, prenatal vitamins. So of course, we need this for our folic acid is our big thing, but also just because we're getting extra vitamins, which will be very helpful, especially for a mom that's in the early stages of pregnancy and not able to eat as much. So some prenatal discomforts can be remedied with dietary changes. So for instance, heartburn, if we can eliminate some items that might cause this more, like chocolate can cause more heartburn. If people are having a lot of caffeine, that can cause some heartburn. Those high fatty foods can cause heartburn as well. So just limiting that or having those small frequent meals will help. And then nausea. So women suffer a lot with nausea. If they would take in, increase their carbohydrates, which some women might love to hear. So increase those carbs, and that can help with the nausea as well. Nutrition and human development are going to be the nursing concepts for women with nutritional needs in pregnancy. And that's because we just need to have good nutrition going on throughout the whole pregnancy to help with human development. All right, let's look at our key points. So our key points for this are that calcium is going to be really important, and this is needed for fetal bone development and for teeth. So mom needs to be getting plenty of calcium. Then our meat, seafood, and cheeses. So we can have no undercooked or raw meat. It is okay to eat lunch meat as long as it is heated and warmed before eating, and we want to make sure that we're eating low mercury. Cheeses should also be pasteurized to be considered safe for eating during pregnancy. Our weight gain. So this is going to also be really important to remember. For those women that are overweight, they need to make sure that their weight gain is between 15 to 25 pounds. For those that are normal or average weight, they can have 25 to 35 pounds of weight gain. And then those that are underweight are going to need a little bit more. So they are 28 to 40 pounds of weight gain during pregnancy. Caffeine. So caffeine is completely safe in moderation. 200 milligrams of caffeine a day is the recommendation. And then just keep in mind that things like chocolate also have caffeine in it. So we need to take that into account when women are calculating how much caffeine they're taking in. Make sure you check out the resources in the videos that are attached to this lesson. Also review any food items that are high in things like iron, folic acid, and foods to avoid, as these are going to be frequent test questions. Now go out and be your best selves today. And as always, happy nursing.